supported the whole time.
So you're leaning.
If you cannot, in this position, tweak it over and try and get it down like that, because that will cause an injury to the knee. And if you have a pre-existing injury, it will exacerbate it. So the way we come to the position is we assume, since so many people have knee injuries, that there's a high probability that this client might have one they have not disclosed. It's the most common thing in the world, that people do not disclose actually what their history is, even though we have forms and we have intake forms and we go through the questionnaire and all that. It's always pretty funny to me by the time I get to here, and then they're like, whoa, 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 I tore my medial collateral in a skateboard accident and it's never been right since. And I'm like, I get the paperwork and flip through the paperwork and I'm like, well, I don't see anything that relates to this here. There's nothing on your list. And what they'll say is, well, they forgot, because there wasn't any pressure on their knee at the time they were filling the form out. So they forgot. Okay, but so many people have knee injuries. It's one of those things. I assume that everyone has back problems until proven otherwise. I assume that everyone has problems with their knees, one or the other or both, until proven otherwise. I assume that everyone is really tight in their hamstrings until proven otherwise. Do you understand? I assume that everyone has tension in their trapezius and shoulders until proven otherwise. Okay? I assume that if they're American, that and North American, South American, that they have issues with their heart and constriction in their chest and breast and around the shoulder, around this chest girdle, front, back, and side, until proven otherwise, right? I assume that they have pelvic instability and restrictions on the adductor muscles in the pelvis until proven otherwise. I assume, right? And see, that way, that's why, because I have those kinds of assumptions, why I bring certain positions always from a place of support until proven otherwise. See, once I determine that your knee is good, that you have good range of motion here or there, well then I don't babysit. I just take you into the kind of motion that would be appropriate for a healthy person. That's what I do. Okay. On the Dak Kha, which is the commonly known as the hurdler stretch or the bent inward knee position, the safety factor is the following. One, this foot has to stay tight to the bottom. It has to stay tight to the bottom, okay? And so when I go to bend the knee inward, right, this foot has to go outside and this distance has to stay the same, right? The second thing is I come up and see my hip is right up against the inside of the knee. And as I take this knee down, there's no crossover. I don't go to the inside at all. I just back up. It's coming straight in position. And then this is where, you know, we're not doing this in the flow we were just doing, but if I was going to actually do this technique with pressure, now I come into testing it for range of motion to make sure. And if I need to tweak, it's always like that, keeping the heel close to the bottom so that this alignment is supported. Nice. Okay? And then when you release this position, it's always straight up from the bottom of the knee, straight up, pulling the foot under the knee. And then that releases all the pressure on the knee. There's no twisting or tweaking, right?